Well, good afternoon, everybody. It's a pleasure to welcome you on this unseasonably warm, if not beautiful, Friday on a weekend of excitement in the city to our second Friday seminar series event of the semester. It's a great pleasure to have Ms. Robyn Hilliard from the University of Pennsylvania, or the Hospital of the University of Pennsylvania, join us today as we talk about the history of Black nursing. As many of you know, within our College of Public Health, we are somewhat unique and very fortunate in that we have a School of Nursing under the umbrella of the college, which I think is just such a tremendous asset to all of us when we think about issues and healthcare issues through the lens of public health. But we also know that it's Black History Month. And as we were just briefly chatting, we know that there's much of an untold history here in terms of the contributions of Black Americans in the history of nursing. And so we're going to have the opportunity to learn about all that today from Ms. Hilliard. Robyn Hilliard is the Clinical Director of Nursing Administration at the Hospital of the University of Pennsylvania. She earned her BSN degree from Widener University in 1994 and her MSN in Nursing Leadership and Education from Wilmington University in 2008. She is currently pursuing an educational doctorate degree in organizational leadership, learning, and innovation at Wilmington University. Robyn has partnered with the Academy of Medical Surgical Nurses in a clinical leadership development task force to develop and author a nationally published educational model for the Academy of Medical Surgical Nurses and related to the core measures and HCAHPS. She is contributing author and presenter in both poster and podium presentations for the ANCC National Magnet Conference, the National Association of Clinical Nurse Specialists, and the Association of Women's Health, Obstetric, and Neonatal Nurses. She's received multiple hospital-based awards from the Hospital of the University of Pennsylvania, including their Patient Safety Advocate Award, the Quality of Patient Safety Award, and also the System-Wide Nurse-Driven Removal Protocol Award. I am going to go off screen as Ms. Hilliard does her presentation. If you have questions for her, please go ahead and pre-populate them in the Q&A feature. I will come back as she is done with her talk and moderate that Q&A session for all of us. And for those of you, those students who are joining us today and looking for the QR code for Suitable, our new engagement platform, I will pull that up at the end as well. So with that, I'm going to turn things over to Ms. Hilliard.
Thank you, David, and thank you for that wonderful introduction and for having me here today. I'm so honored to be here with all of you to discuss some of what I have learned about the historical contributions of Blacks in nursing. And you may ask yourself, why this topic, why now? So I'll share a personal story with you. Several years ago, my husband brought a book home from the library for me. And the name of the book was The Path We Tread, Blacks in Nursing. And I was reading the book, and I was about maybe 5 or 10 pages into the book. And I was so intrigued with what I was reading and learning. And so I called out to him and I said, Jimmy, you have to find this book for me. I need to own it. And this copy has to go back to the library, but I need to own this book. And he was able to find the book, and online it said that it was a good copy. And I was a little concerned about that because the book had been in publication since 1986. And when the book arrived, I was excited. It was a great copy and I was happy. And then I started to feel a little disheartened because the book came from a library in a state out west. And because it was such a good copy, it made me question, had anyone picked up the book to read it? And does anyone know about a lot of the rich information that's in this book? And so it was really at that moment that I decided I would share this information with others, even though I had not finished the book. And I didn't know how, I did not know when, but I knew that it would happen. And so here we are today, where I am able to provide some of this information for you. And I've had an exciting time over the last couple of years sharing this work. We do have some learning objectives for today. We will identify some of the early nurse heroes. describe the inaugural Black nursing schools admission standards and operating conditions. We'll look at some of the Black nurse stereotypes and also some of the strategic methods that were used to advance the professionalization of Blacks in nursing. So when I did this presentation in person, it was pre-COVID, and I asked people, who is this person? And of course, a ton of hands go up when you're in the room with nurses, because everyone knows that this is Florence Nightingale, and we all learn about her in nursing school. And she is known as the mother of modern day nursing. And she was of upper social class. She defied her family's wishes to marry a man of prestige, and she pursued nursing, which she really considered to be a calling. And her most notable contributions were during the Crimean War, where she was asked by the Secretary of the War to assemble a group of nurses to go to Crimea to provide care to the wounded soldiers, because they were dying at alarming rates, and they were living in horrible conditions at the hospital camp. And so she worked tirelessly night and day to provide care, and she was able to reduce the death rate by 2/3. And after the war, she opened a nursing school. So this is just a small snippet of why she is credited as being the mother of modern day nursing. But when I asked the question, who is this person? Does anyone know this person? The first time I gave this presentation, I did not receive any hands. No hands went up in the room. And this is Mary Seacole. And Mary Seacole was a British Jamaican woman who wrote letters to the British War Office and Florence Nightingale requesting to be on the team of nurses caring for the soldiers in Crimea. And she was refused many times, and she was told that there were no living quarters for her, or that there were no vacancies on the team of nurses. And so this was not good enough for Mary, and she used her own money to sail to Crimea because she was determined to help the soldiers. So when she arrived, she set up a makeshift hotel, which today we would consider like a storefront. And she cared for soldiers there, but also sold needed items that they needed at the time. And Mary continued requesting to be a part of Florence Nightingale's team. And after being told no many times, she was finally permitted to work with Florence, but it was only at night. And she often referred to the soldiers as her sons, and they referred to her as Mother Seacole. But when Mary returned to England, she was very ill, and she was bankrupt because she used her money when she was gone. And the press and many of the British officials and military, they organized a festival in her honor to raise money for her. And enough money was raised for her to live off of for the rest of her life. And this is a statue of Mary Seacole in London that was unveiled in 2014. So prior to the professionalization of nurses, many women and men provided nursing services without any type of formal training. And during the Crimean War, the Civil War, the Spanish-American War, Blacks made significant contributions that helped pave the way to modern day nursing. And during the Civil War, many nurses provided care without any type of compensation. And those who were officially appointed as contract nurses, they were paid $12 per month, or about 40 cents per day. And also they were provided their food. Now, Sojourner Truth, mostly known for being an abolitionist and a lecturer and women's rights leader, she also worked as a nurse during the Civil War and thereafter. And she worked at Freedmen's Hospital in Washington, D.C., where she was appointed to this role under the U.S. War Department. And Freedmen's Hospital was an emergency facility that was developed to address the severe health needs of formerly enslaved people who converged on Washington, D.C. after the war. And Sojourner Truth worked as a nurse and a counselor at that time. And she also organized a group of women to work in Freedman's Hospital to help clean it as well, because she believed, like we all learned about Florence Nightingale, that people could not get well in filthy surroundings. And she also appealed to Congress to designate funds to train nurses and doctors. Now, Harriet Tubman, who we all know for her heroism leading enslaved people to freedom, she also served voluntarily as a nurse during the Civil War. And she was known for her compassion and her generosity and her generational home remedies to treat infections. And because she did such great work as a nurse, people wanted her to be paid for her work, but she did not receive any compensation during the war. But 30 years after the war was over, she was granted a $20 per month pension for the rest of her life. And just to provide a little bit of context, during that time, average wages was about $2.50 per week. And she was also given military honors upon her death. Susie Taylor, she's another early nurse and teacher who volunteered to care for wounded soldiers. She was not contracted by the government, and therefore she did not receive any type of payment. But for 4 years, she did provide her services. And then also during the Spanish-American War, there were epidemics of typhoid fever, yellow fever, that was killing the soldiers at alarming rates. And the death from infectious diseases caused 7 times the number of deaths that were from the soldiers' battle wounds. And so Namayoki Curtis was the wife of a surgeon at Freedman's Hospital in Washington, D.C. And since she survived yellow fever and was presumed to be immune to the disease, she was placed under contract by the government to go out and recruit other Blacks who were believed to be immune to also serve as nurses to the soldiers. And during this time, there was a belief that Blacks were immune to tropical diseases, and yellow fever and malaria. And therefore, oftentimes they were sought out to care for the soldiers. And she was able to recruit 32 nurses, which was almost half the number that are documented that served during that time. The total documented is about 80. And the contract nurses were paid $30 per month. And after the war, she continued serving in rescue and relief efforts during natural disasters, and one of which included working under the direction of Clara Barton with the American Red Cross during hurricane relief efforts in Texas. And she is buried in the Arlington National Cemetery in Washington. So post-Civil War, Americans realized that there was a great need for better medical care. And realizing that there was a lack of trained nurses, voluntary associations erected makeshift hospitals that literally scrounged for supplies due to poor funding. And the public did not trust hospital care at this time, and they preferred to receive their treatments at home. And they were seen as a place to go and die. And there was a perception that only poor people went to the hospital. So with the emergence of hospitals, there became more of a need for trained nurses. And trained nurses were needed, and hospitals did not have a lot of funding. So what do you think they did? What was the solution? What was, they needed cheap labor. So they utilized nursing students. And in 1869, the American Medical Association recommended training of all nurses. And the first 3 American schools were founded in 1873. Massachusetts General in Boston, Bellevue Hospital in New York, and New Haven Hospital in Connecticut. And these schools followed the Nightingale tradition, emphasizing uniforms and strict military type discipline and a preference of middle-class students. And they also emphasized cleanliness and how important cleanliness was to healing. And by 1880, there were 15 nursing schools, and by 1900, there were 432. So the preferred qualifications of nursing students was highly focused on physical abilities, such as muscular strength, endurance of fatigue, the ability to withstand lack of sleep. And they also were highly focused on moral beliefs, such as patience and honesty and selflessness. They preferred women to be between the ages of 21 to 35 because there was a belief at the time that younger women had less familial responsibilities and that they would be deeply committed to nursing. A few of the schools offered students a stipend. Many students pledged to serve the hospitals anywhere from 18 months to 3 years. And nursing schools during this time was also highly focused on the task that needed to be completed. So from what I have been able to gather thus far, and I'm still looking, there's scarce documentation of the history of Black men in nursing. And many male nurses were referred to as orderlies. And there is some documentation of them working with Florence Nightingale. But there was a lot of discriminatory practices toward male nurses in general. It was prevalent. And oftentimes they were also denied nursing school admission and not allowed to work in pediatrics, obstetrics, or provide care to female patients. And they were most often utilized for mental health. And in the mid 1700s, James Durham, although he did not receive any type of formal education, it is said that he worked as a nurse and as a physician, and that he had a really lucrative practice, making $3,000 per year, and that he spoke several languages, and that he was able to serve diverse races. Now, because of the many limitations in the South, many Blacks traveled north for hopes of better opportunities. And this contributed to overcrowding in many of the large cities like Philadelphia, Detroit, New York, Chicago. And facilities that were opened after the Civil War to treat illnesses erupting from the poverty and the racial oppression had all closed by 1877, except Freedman's Hospital in Washington, D.C. And the deterioration in the health of Blacks, many people believed was linked to the absence of an adequate healthcare delivery system and the lack of trained Black doctors and nurses. There were severe food shortages and unsanitary conditions, and that overcrowding that contributed to the spread of many contagious diseases. And for Black women, it was even more bleak. Childbearing complications and infant mortality significantly increased during this time. And by the early 1900s, hospitals had established themselves as a place of healing and gained some respectability, and many had established nursing schools. However, because of the racial segregation, few Blacks were admitted into the nursing programs. In the North, there were racial quotas, and in the South, many times it was non-admittance at all. And of note, Black physicians were also denied proper education and internships. So this led to the development of separate hospitals and nursing schools. And philanthropic individuals and groups such as John D. Rockefeller, Andrew Carnegie, and Julius Rosenwald of Sears, Roebuck and Company they began financing hospitals and nursing schools for Blacks. In fact, Rockefeller and his wife financed the development of the first Black nursing school, the Atlanta Baptist Female Seminary, which later was renamed Spelman College. So with the emergence of these Black hospitals and nursing schools, the motivation of those individuals or groups who financed them, it was sometimes questionable. And some did it for financial gain and social influence. And that's why they decided to support Black hospitals and nursing schools. Even Black physicians funded these hospitals and schools in hopes of gaining more opportunities for training and internships, since they were often denied those privileges. And these facilities were oftentimes funded just to protect segregation. Let's just keep everyone separate. So despite philanthropic and other monetary contributions, these institutions really struggled to maintain operations after opening and also gaining the respect of the Black community. So the schools were plagued with inadequate funds, supplies, and oftentimes they exploited the nursing students. So in 1882, Nathan Mosel, who became the first Black male to receive a medical degree from the University of Pennsylvania School of Medicine. And on October 31st, 1895, the Frederick Douglass Memorial Hospital and Nurse Training School opened right here in Philadelphia at 1500 Lombard Street. And it was the second Black hospital in the United States. And he hired Minnie Clemens, who was the first Black graduate of the University of Pennsylvania Training School for Nurses, as head nurse. And although most of the patients were Black, it was marketed as a colorblind institution. And by doing this, it allowed Mosel to secure an annual $6,000 from the state to aid in operating the institution. And similar to other like institutions, they often operated with a shortage of supplies, including lack of dressing supplies and linens, sometimes no hot water and poor ventilation. There were even times that it just was not enough money to pay the hospital employees. But to provide some context around the qualifications of Black nursing students, letters of recommendations were required, one from a doctor to ensure the good health of the candidate, and also one from a pastor who could testify to their good moral character. And there was a preference for the students to be single, and they wanted younger women because administrators felt that they were easier to manage than older women. And there was a probationary period, anywhere from 2 to 6 months. And during this time, the women mostly performed hospital maintenance and domestic chores. And when they successfully completed this probationary period, then they would be allowed into the official nursing program. And some schools actually required that students deposited return fare upon arrival to the school, because they did not expect that those who applied and were accepted to actually finish the program. And so it's no secret that nursing students, both white and Black, during this time were exploited for their services. And the Black women were under constant surveillance. And they lived in common dormitories that offered no privacy. And in some instances, they even had to share their beds, and they slept in shifts. So Black nursing students and nurses endured perceptions of negative stereotypes that was threefold: racial inferiority, because they were Black and not white; social inferiority, because they were women and not men; and professional inferiority, because they were nurses and not doctors. And there was a strong perception that Black women were immoral, and that because of that, there was special attention paid to their moral character, and they considered them to be sexually promiscuous. And it was not uncommon practice for if a nursing student or nurse was ill and complained of abdominal pain, it was common practice that the house physician would perform an internal pelvic exam and also, obtain a smear, because it was assumed that this Black woman had to have a gonorrheal infection. And apparently, this was a very common belief. And, when I read this in the book, it reminded me of a story my grandmother told me years ago, because I am a third generational nurse. And my grandmother told me a story. I was in my teens, and she said she was, she would always tell me stories from the hospital. And she said that she remember a woman that came into the hospital, and she was in so much pain, and she was crawling on the floor and complaining of abdominal pain. And my grandmother said, well, we knew she had PID. And most of us know that, pelvic inflammatory disease, one of the common causes is an untreated sexual transmitted disease. And so, at the time that she shared this story with me, of course, I didn't think anything of it. And it wasn't until I read this that that story actually came back into my mind. And I said, wow, so this particular stereotype, it ran deep. These nursing students sometimes were given a stipend of anywhere from $4 to $7 a month, or sometimes it was just refused and they did not receive anything. And since nursing students were the main workforce for the hospitals, most of their classes were conducted in the evening after all of their work had been completed. And you want to keep in mind that during this time, nursing had not yet evolved into the scientific inquiry and application that we practice with now. So it was more focused on those strong moral character, the endurance and obedience, and very much so mirroring the military. So nursing licensure was not initially required of all who practice nursing. And many nursing leaders believed that registration acts would help to move nursing towards professionalization and gain respectability from the public. And in 1903, North Carolina passed the first Registration Act for licensure of nurses. And in 1938, New York became the very first state to require a license for nursing practice. And in 1939, the American Nurses Association announced its support for mandatory nurse licensure nationwide. And although nurse licensing and guidelines and practice acts were adopted into state legislature, a lot of Black nurses were not allowed in many Southern states to sit for the licensure exam. And if they were allowed, different exams were administered because there was a belief that Black nurses were not qualified, or the claim was made that the schools they graduated from did not meet the requirements to sit for the exam. And if they were allowed, then separate exams were administered because the belief was Black nurses could not possibly pass the same exam as others. Now, Ludi C. Andrews, she was a graduate of Spelman College, and she was granted licensure in 1920, but she refused to accept it until others were afforded the same opportunity. And she won a 10-year battle with the state of Georgia to allow Black nurses to take the same examination. And this was an account of what she shared. I am at present the only registered colored nurse in the state. It has been a long, tedious, and hard fight, but I can truly say some things come to those who wait, provide they work while they wait. I am happy to think that the other nurses who come after we are gone will not have to wait as we did. And with this accomplished, I am resolved to do all in my power to elevate the standards of nursing by my own personal conduct and professional service. And I had to include this because I thought it was so powerful. And for many years, I'll admit, I didn't know, and I didn't learn in school about licensure, or at least I didn't remember learning it. And you oftentimes don't think about what were some of the struggles of those before us that really did help pave the way. So at the same time that the National Nursing Council for War Service was established, President Roosevelt set up the Federal Security Agency of Defense, Health, and Welfare, which included a subcommittee on Black health. And Mabel Stoppers was asked to be a member of the committee, along with Albert Dent of Dillard University, whom we'll hear about in a minute, and other Blacks who held positions in hospitals and in academia. And because of her fear of being excluded from wartime service, Stoppers formed coalitions with Black professional organizations and civil rights organizations, philanthropists, and other non-Black nurse leaders. And she also developed the NACGN National Defense Committee. And she met with the Surgeon General and discussed concerns of Black women being excluded from wartime service. In October of 1940, the War Department announced that the use of Black personnel would not be called to duty unless the number of Black wounded would justify the need to develop separate facilities. So in 1941, the first 56 Black women were inducted into the Army Nurse Corps and designated to work in the wards providing care to those wounded Black soldiers. And although they were inducted, they continued to face discriminatory practices such as unequal pay. They were paid $70 per month compared to civilian nurses who were paid $125 per month at the time. And they also suffered from dishonorable discharge if they became pregnant and were unwed. And that also included loss of pension benefits. And Stoppers and colleagues, they continued to protest, to write letters and meet with war officials to end the quotas and other.
Robyn, I'm sorry to.
Yes. Can you still hear me? I cannot hear anyone. Okay, I will continue.
Robyn, are you back?
Did I go away?
Ah, you're back.
Oh, I couldn't tell. I was still talking.
You froze on my computer. I kind of assumed you froze on everybody else's, but maybe it was just on my end. So it does sound like people hear you, but if you can tell us a little bit more about Mabel keeping Stoppers, I think we'll be caught up.
Okay. So I'll go back a little bit. So in 1941, so Mabel was she was really influential in doing the work to allow Black nurses into the Army Nurse Corps. And in 1941, the first 56 Black women were inducted into the Nurse Army Corps and designated to work in the wards providing care to wounded Black soldiers. And although they were inducted, they continued to face many discriminatory practices. There was unequal pay where they were paid $70 per month compared to civilian nurses who were paid $125 per month. They also were subject to dishonorable discharge if they became pregnant and were unwed, including loss of their pension benefits. And so Stoppers and her colleagues, they continued to protest and write letters and meet with different war officials to end the quotas and other discriminatory practices, including the Army's practice of utilizing Black nurses only to care for German prisoners of war. And she also fought against the announcement of a nurse draft in 1945. And she argued that a draft just was not necessary because there were many Black nurses who wanted to serve but were prohibited. And if you go online, you can really find a lot of those personal accounts, handwritten letters from nurses that offered their services and really were eager to go and help. But you will also find there were many letters in which they were denied. So now that we have familiarized ourselves with a few of the wartime nurse heroes and the emergence of Black hospitals and nursing schools and the common stereotypes, let's pivot to how Black nurses advance the profession through professional and collegiate organizations. So the NACGN, the National Association of Colored Graduate Nurses, was founded in August of 1908 by a group of 52 Black nurses to combat racism within nursing and battle the exclusionary practices of professional organization participation. And these efforts were led by three women. So Martha Franklin, she attended the Women's Hospital Training School for Nurses in Philadelphia in 1897. And she sent over 1,500 letters to fellow Black nurses to speak about nursing school conditions, the lack of employment opportunities, and also denial into nursing organizations. And Ada Toms, she was a member of the Lincoln School for Nurses Alumni Association. And she also worked as a teacher as well. But initially, she studied nursing at the Women's Infirmary and School of Therapeutic Massage, where she was the only Black woman to graduate in a class of 30 students. And she also wrote a book in 1929 on the history of Blacks in the nursing profession. And she was among the first nurses inducted into the ANA Hall of Fame in 1976. Now, Mary Eliza Mahoney, you probably have heard of her because she's probably one that I would say that, was mentioned or is mentioned in nursing schools because she is credited as the first Black professional nurse in America in 1879. And she received her diploma from New England Hospital for Women and Children. And she was only one of 3 people in her class to complete the 16-month program. And it was the first school to charter acceptance of 1 Black and 1 Jewish woman per year. That's it. And many of her patients would give testimony of her level of compassion and expertise. And she also championed women's rights and was one of the first women to register to vote in Boston in 1920. And in 1936, an award was established by the NACGN in her name because of her nursing expertise and accomplishments in promoting interracial relationships. And she also went on to be inducted into the ANA Hall of Fame. And the goals of the NACGN were they wanted to improve the quality of nurse training. And this was a real palpable concern of Black nurses. And almost 20 years later, in 1925, the Rockefeller Foundation completed a study about the state of nursing education in Black nursing schools. And what they found, they said that the results were so bleak that they actually didn't make them public. Which so we hear over and over again, or we read over and over again in the literature just now about some of the conditions. Now, the NACGN, they also wanted to promote interracial relationships and employment opportunities. They wanted Black nurses to be able to participate in nursing organizations, and also attack some of those salary discrepancies because they were not being paid equally, and also encourage advanced nursing training. Now, some of their achievements was successful integration of the Cadet Nurse Corps. They also established a national registry for Black nurses to assist with employment opportunities, among other achievements that I have listed here. And in 1951, they felt that they had really achieved what they set out to do. And so they merged with the American Nurses Association. Now, although the NACGN was dissolved in 1951, 20 years later, many Black nurses still felt that more needed to be done in order to address issues Black nurses faced, and also the state of health of Black people, and also their roles in professional organizations. So this was still a concern for them. And the Council of Black Nurses and the Bay Area Black Nurses Associations, they shared common goals where they really wanted to influence and improve the health of Black people, promote inclusion of Blacks in nursing leadership and educational positions. And so this led to the formation of the National Black Nurses Association, which is still in existence today. In the 1930s, nurse leaders supported the Association of Collegiate Schools of Nursing in the decision to reduce the number of hospital diploma nursing schools and transition from hospital to collegiate level education. And they believed that university affiliation would result in higher standards in nursing care and improve public respect, as well as facilitate better prepared nurses. And Black nurses and institutions were encouraged to embrace the same goal to move toward collegiate education for nurses and upgrade the quality of instruction in the Black nursing schools. And in 1937, Estelle Riddle, she wrote an article declaring how and why this change should happen. And she included details of the importance of this transition, so Black nurses could have the opportunity to secure leadership and administrative positions. And she began to pressure Black colleges and universities to establish baccalaureate programs. And Dillard University became the most highly acclaimed program in nursing at the baccalaureate level in the 1940s. And so I wanted to just share the success story with you. So Albert Dent in the 1940s was the president of Dillard University. And he had a firm belief that the hospital was more than a building and equipment, and that it was a place to go to receive treatment and comprehensive medical care, not just to go and to die. And he knew that he needed to help Blacks understand and trust those in healthcare. So he set out to alleviate the Black community fears about healthcare and introduce programs both inside and outside of the hospital as a strategy to build relationships within the community. And New Orleans at the time had the highest Black death rate in the country and very high infant and maternal mortality rates. So he created mothers clubs that met 2 times a month, in which a healthcare provider from the hospital would speak to moms about prenatal care and the value of a hospital birth. And these efforts actually contributed to an increase in hospital birth. But he was also able to secure home federal and philanthropic funds to develop a 6-month midwifery course for graduate nurses to support home delivery options as well. And well baby clinics were established in which new mothers were urged to bring their babies to the hospital 1 time per month for a year for general observation and also instruction on infant care. The nurses, they lectured at public schools, colleges, parent-teacher associations, and with ministerial groups to heighten the awareness and stress the importance of seeking healthcare for treatment. He also worked closely with the National Youth Administration to train young Black teenagers to work in the hospital as orderlies and nursing assistants. And while they were in the program, the hospital arranged for doctors and nurses to lecture to the students the fundamentals of personal hygiene. And he also developed the hospitalization insurance program. And this program was the penny a day plan. So for $3.65 per year per person, someone could receive complete hospital services. And this was made possible through a Rosenwald fund, but eventually this insurance program, it actually became profitable. Now, Dent hired Rita Miller and appointed her the director of nursing at Dillard University. And Miller went out and she toured the best and the worst nursing schools, those that were integrated, those that were segregated. And after completing this tour, she spoke with many of the professional organizations, and she completed a report detailing the most significant problems Black nursing schools were faced with. And what she found was that there was underprepared faculty, poor curriculum, and weak administrative management. And so she's a nurse, and like many nurses, when we identify a problem, what do we want to do? We want to fix it. So she designed a plan addressing each of these problems and how to fix them. And so Dent established at Dillard that the nursing division was equal to all other divisions, and that nursing instructors, they were given professional rank and tenure and also salaries. All the faculty were required to have as a minimum qualification a master's degree. And this was challenging in nursing. And so they did agree to hire those with bachelor degrees if they showed great potential for continuing education and also demonstrated professional aggressiveness. Now, Miller arranged for fellowships for the nursing instructors to be able to pursue specialized training. And they updated the curriculum to a 5-year program leading to a bachelor's degree. And it focused on 5 areas: the biological and physical sciences, social sciences, humanities, medical, and nursing. So for the first 18 months were general academic courses, including the history of nursing. And for the last 3 years, the students spent time in the hospital that was associated with the institution. And so Dillard University is credited as the first accredited college nursing program in Louisiana. And that really brings us to the end of my presentation. And I have some key takeaways for you. The history of Blacks in nursing is full of struggles and triumphs, and they contributed to advancing the profession in many ways in which we scratch the surface today. And I ask you, does knowing the history influence current nursing practice? But I also want to let you know, you are making history today. And what will they say about you? What will they write about you? And I thank you for your time, and I will turn it back over to David.
Well, Robyn, thank you for that very engaging presentation, and I very much apologize for interrupting you. For whatever reason, I'm in the office, and for whatever reason, your voice started to get garbled, and you froze on my camera, and I just assumed that it was the connection between Temple and Penn. I didn't think that it would just be unique to my computer until everyone started chiming in the chat saying, David, we can hear her. So I very
Okay,
much apologize for interrupting you and throwing you off. I thought it was a larger problem, not just a me problem.
no
So thank you
problem.
very much. So we
You're
do
welcome.
already have some questions in the Q&A. So let me go ahead and start us off there, and hopefully some other people will chime in as well. So the first question is, what challenges do you see going forward for people of color to truly inform and influence the clinical and educational landscape of nursing?
I think, you know, some of the challenges, I think we have to continuously be willing to change and evolve, because our patients change, the communities change, and we have to be willing to change with those. And I really think that nurses have to be willing to participate in activities outside of clocking in and coming to work each day. But what are those things that really matter to us? And how can we be influencers of change? And whether that is through professional organizations, or, I don't want to talk politics, but, you know, being involved and being able to change some policies and things that are out there. So I think we have to be willing to step out a little bit on faith and do more than come to work. And I think many of us already do that, but we have to continue to be willing.
And I think, as a follow-up, I think that, as you pointed out, nursing practice has really evolved. But as somebody has asked, nursing practice has drastically changed just in the last 50 years, let alone as far back as you took us. How do you believe that modern nursing practice should reflect those heroes?
I think we should continue to tell the story. This was a great opportunity for me to meet with everyone and be able to share some of this information. But as I mentioned earlier, I'm not finished, and there's a lot of information, and I continue to look for more information to place into these presentations. But we have to be willing to look for the information and then really have a commitment to sharing it. And I think we have to have more programs like this where people are invited in to talk about it in different schools of nursing, but also look at the curriculum and look at it with a critical eye and ask yourselves, are we introducing our students to this? Are we doing our due diligence with really sharing the experiences of nursing, but all nursing, not just one, but really looking at it. And this can even be expanded into other races. I envision one day being able to see a panel where we're able to talk and have nurses of different ethnicities really have the opportunity to talk about contributions that their culture made to nursing, because I think there's a lot we don't know, and I think we need to spend a lot more time talking and exploring those things.
So I think this is a really interesting question I'm about to ask you, and may challenge you a little bit too.
Okay.
What are some of the common ways in which health professional schools today, including nursing schools, perpetuate medical racism and prejudiced attitudes? And how can we as students and practitioners dismantle those issues through our practice?
That was a mouthful, David.
I warned you.
The first thing that comes to mind for me is that we have to be willing to talk about it, and we cannot be afraid, and we have to be willing to listen. I mean, truly listen to what others are saying, so that we can start to change. I think a lot of times people are offended by, are you still there?
I'm still here. I had to put up this.
Oh,
We have a new and this is the second time I've interrupted you, and I apologize. We have a new platform for our students to record when they engage with different activities, so they need access to this QR code. So I
okay.
apologize for that.
Yeah, so I think people, we have to step back a little bit and not be offended to have some of those hard conversations. I think that's a really important an important action that we need to take.
Do you as a follow-up to that, do you feel like the events of the last couple of years, the challenges of COVID, but I think maybe even more importantly, how health professionals were being targeted as part of the conspiracy? I actually saw something on social media yesterday of a physician who was working in an emergency department, spent 2 hours resuscitating an 8-year-old who was on the verge of dying. And when she came out to talk to the parents said, well, I hope you didn't inject him with those COVID vaccines while you were in there. And do you feel like it's gotten even harder in the last couple of years because of the way that healthcare professionals, not just nurses, but I think almost all healthcare professionals, have really been put, the bullseye's been on some of us as part of the whole conspiracy behind the pandemic?
I think absolutely it has definitely gotten harder from my perspective. I've been in nursing for almost 30 years now, and there has certainly been times over these last several years that has just felt so hard. And sometimes, where many of us have stopped and asked ourselves, like, oh my gosh, is this what I signed up for? And why do I continue to do this? But I definitely feel that it has gotten harder. And I think that we have to continue to look for ways, just like like Albert Dent, and I mentioned in the presentation, look for ways of how we can connect with our patients, connect with the community, and really rebuild that trust.
I'm now 3 for 3 with technological problems today. So, but as Kim helps me out here behind the scenes, I'm going to get to our last two questions. Do you have any specific advice for young Black men and women who are starting their careers in nursing?
Well, the first piece of advice that comes to mind that I often share with new nurses is, this may sound funny, but you are never going to get paid what you think you're worth. It's really hard to put a number on what we do. And if you go into nursing because you've heard from others that it's a great salary, that will not sustain you. It's not enough. You have to really go into nursing because you truly care and you want to make a difference. And so I challenge people to really reflect on, why is it that you chose this profession? Because we need people to show up every day and we need them to give 110%. And we know that it's challenging. And some days you want to run away screaming, but you have to have a deeper reason for why you chose this profession. There are lives in our hand. They depend on us. And so that is just a piece of advice that I often give. And another piece of advice I share is that I challenge people to act as a sponge. Constantly look to learn and how you can elevate your nursing practice, and not just yours, but those around you, because you don't want to just soak everything up and then you don't share any of it. So we need to be able to that lifelong learning that we've all talked about, and that many of us agree that nursing is lifelong learning. but you take that information in, but you need to share it because there are others that that need to grow and elevate as well. And so, I want to be a shining nurse, but I also want all of those around me to shine as well. And when you see errors and things happen in healthcare that is disheartening, you know, although it may not have been, I didn't do it, but you feel that sense like, oh wow, this could have been me. And so I think we have to make sure that we're supporting one another and that we're really the information that we're learning, that we continue to evolve, not just for ourselves but for the nursing community at large and our patients that we serve.
So you've done a wonderful job of taking us through the history. We now just talked a little bit about the present, but I want to end with asking you to share with us your thoughts about the future. What do you think the biggest challenges are for the field and its relationship with not only medicine, but also other allied health professions who work in the space? And what do you think needs to happen for nursing to continue to grow and thrive as a profession?
To grow and to grow and thrive as a profession, I think that it goes back to, reflecting on why you chose this, and how you make a difference. Several years ago, someone asked me, why did I go into nursing? And I shared with her, I said, I really wanted to make a difference. I knew that I was going to be a nurse from a young girl, and I really wanted to make a difference. And she said to me, oh, I thought you would have a much more elaborate response. And I said, I really don't need a more elaborate response. You know, all of us have something to give. And, that's the reason that I entered nursing is the same reason why I'm still in it. I do think, one of our challenges for the future is around a lot of the workplace violence that we tend to see. And I think that we'll need to continue to learn about that, but really come up with viable strategies of how we can address it, and how are we disseminating and sharing that information. Because you may have, is it something that everyone is struggling with, or is it, or has someone figured it out? And I don't think anyone has, but we have to be willing to also to share, because that is a real concern. And how do we support our nurses with with what has been occurring in healthcare around workplace violence? That's just a real concern that I think we need to address as a team.
Well, I think that's and I agree with you. I think, whether we're talking about issues that were related to the pandemic or some of the other issues that we've even seen in Philadelphia over the last couple of years, in terms of that hospitals and healthcare facilities are no longer immune to workplace violence, I think is sobering for all of us. Robyn, I want to thank you again. I also want to apologize for showing all of my technological blind spots during your presentation. I really hope that as you reflect on sharing this time with us, that it doesn't color it to the negative. But I think you've given us a wonderful gift, not only to the many nursing students and nursing faculty that we had on, but to our entire college public health community. As I said at the onset, we are so pleased and so appreciative of the fact that we have nursing as part of our community. We learn so much from them. We like to think they learn a little bit from us, and we all certainly learned a lot from you today. So thank you very much for spending some time with us. It's greatly appreciated. Enjoy the weekend, enjoy the football with your Eagles green.
Yes.
And hopefully we'll have an opportunity to interact again in the future.
Thank
Thanks
you
again.
so much. Thank you.
Take care, everyone.
Bye-bye.